Great. Welcome, everyone. Thanks so much for joining. I'm Mary Wheatley, CEO of the National Scleroderma Foundation, and I am joined on this Giving Tuesday by Kate Anastasia, our Senior Director of Mission Delivery. Hi, Kate.
Hi, Mary. Hi, everyone. Nice to
Well,
be here.
thank you so much for joining. I can't think of anyone better to be with us here on Giving Tuesday when we're talking about the impact of your giving on this Giving Tuesday, because your team is the one that makes the magic happen and that makes all of the mission delivery work in conjunction with all of our great volunteers around the country. So thank you for joining. And as we chat a little bit about what that looks like, I also want to thank our sponsors and partners at Amgen for matching up to $25,000 of every gift that comes in as part of Giving Tuesday. So thank you to them. And if you haven't had a chance to give yet, you can go to scleroderma.org/Giving Tuesday and make your gift count. So Kate is going to talk to us a little bit about what her team does and how they support the mission. And we look forward to interacting with all of you on the live.
Thanks, Mary. As you had said, our team is responsible for our three mission pillars. So ensuring that our support programs are there for families, whether it's someone who's newly diagnosed and needs our Hope Line, or someone who's just looking for, a place where they can receive a diagnosis or get care, and also all of our support groups, to our education programs where we help folks learn about the disease, raise awareness about the disease, and also help educate the physician community as well, or the clinicians. And then, of course, our research program, which everyone knows that our organization is funding some of the best research in scleroderma right now.
Absolutely. And we just had a chance to be with some of our researchers from across the country. And I know that was really exciting for everyone on the team. Do you want to share a little bit about what that was like?
Sure, being at the ACR was an amazing experience. We had the opportunity to walk around and see some of the posters that were on display from some of the researchers, but also for me, it was being at our exhibit booth. So to have all of the doctors and nurses walk by, and even those who live in the United States, telling us how we are the first resource that they give to families when they're newly diagnosed, but also all of the folks from outside the United States who still said that they used the fact sheets and all of the information that's on our website so that they could either translate it into another language, but also so that they could give it to folks outside the country who are diagnosed with this disease. So to know that we're such a valuable resource to everyone, it was just amazing.
Oh, well, it was amazing going to the poster hall with you and getting a chance to see some of the research that we're supporting being presented at the meeting as well, and seeing some of our rock stars of scleroderma there, kind of a family reunion
Yes.
situation that it always feels like. But I know that we're just so grateful too for their expertise that they lend to us, and that you get to work closely with our medical and scientific advisory board. And they're the experts that really are, diagnosing and treating people living with this disease who are putting together these fact sheets that you mentioned.
Yeah.
So what a cool
Oh,
opportunity.
absolutely. To meet them in person, yes. But also, they help us with all of our patient materials, but they're also the ones that work with us to say, you know what, we're seeing gaps in, this need with physicians or clinicians, and they're the ones that help us set our CME programs. So that's equally as important to make sure that primary care physicians understand this disease, to make sure that rheumatologists understand this disease so they could make accurate diagnosis. And the MSAB is responsible for so much of that work.
We're so grateful for them and for all of the wonderful volunteers across the country that you and your team work with. So what's been one of your favorite things from this year? I know
Easily
you've
conference. Easily. I know. It's just for
yeah.
me, I was still so new in my tenure with the foundation, but to be there and just see the connections between the patients themselves, right? So everybody was either the best of friends or on the verge of becoming the best of friends, but connecting with each other. I remember seeing some of the doctors, the presenters, actually walking their patients to different sessions that they thought would be most valuable for them. And then it's amazing. And now that we're starting to work on next year's conference, so I hope I see y'all in Seattle in July, but just, working with Angel and the team to make sure that this is going to be everything that everyone hopes for, because it really is. It's the place to be for an educational event. I hope everybody can join us.
Absolutely. So July 19th through 21st, right, of 2024. I look forward to seeing everyone in Seattle. I have to say, conference was really a highlight for me too. This being our first time back since 2019, I didn't really know what to expect. It was my first in-person conference, and you and your team, you and Angel and the whole team really just knocked it out of the park. And just seeing the engagement from, again, the MSAB, but our patient advisory board and our chapter leadership and national leadership was just really, really inspiring. I mean, people pushing wheelchairs and
Oh,
helping to, navigate the meeting for first timers, and so many first timers that were there. It was really amazing, and we had about 600 people, right?
yeah, but both in person and then virtual. And I loved, Mary, too, that a lot of our patients are on some panel discussions. So it's them after they're, living with the disease for so many years that they can impart, the strategies and tools and lessons learned on others. It was just absolutely amazing to me. It really was. I can't say enough great things about our conference.
It's truly our mission in action, and seeing that partnership, like you said, between our healthcare provider teams who are truly the experts in kind of, again, diagnosing, treating, managing the disease, and then our patient partners who have the experience and lived experience and expertise of what it's like to live with and manage this on a day-to-day basis. That partnership is really amazing. And that's where it really kind of all comes together. So in addition to kind of the in-person conference, which is super exciting, and we do
Yeah.
hope to see people in July, what else should people be on the lookout for in terms of really being able to make an impact through the mission?
So also, I feel like our Hope Line is such a valuable resource to families, and unfortunately, it's like the best kept secret in scleroderma. And I talk to Karen about it all the time, and she's just such a helping voice. I remember her sharing a story about a couple who, she had just been diagnosed. They were sitting in their car calling her from the parking lot, and by the time that 45-minute call was over, she had stopped crying. Karen had already set them up in a newly diagnosed support group and a caregiver support group, and had already sent her information about a designated scleroderma research and treatment center. So we forget, or we don't recognize all of the valuable information that can come from that call to the Hope Line. Another time, she had gotten a call from someone, and they were a veteran. So, we don't know or understand all of the ways that VA works, but what did Karen do? She found a social worker who worked for the VA and kind of got all of the necessary information to give back to this person. So it's all of those things that we can do to help someone newly diagnosed or with an existing diagnosis find the tools and the resources that they really need.
Absolutely. And
So,
that's what we're all about, whether it's through Facebook Live or Instagram or the website. So often we forget about just picking up the phone, and you can call 800-722-HOPE. That's our Hope line. And you can
yeah,
talk to a real person who's there to help you. And we'll connect you with someone in the community as well, if you're
yeah.
interested in that, or a support group, or anyone in your area that can really just share their experience of what it's been like living with the disease. Because what we don't want you to do is to go to Google or WebMD, which are wonderful resources in and of themselves, but we have, again, that those great resources that have been put together by experts in the field. So really appreciate the work that you and your team do there.
Yeah. And of course, with the education programs, yes, conference, but we also do webinars, national webinars on topics that folks will suggest to us, or that our MSAB will come to us and say, we're hearing a lot of questions about CAR T
Yeah,
therapy. Maybe you should do a webinar about that. And then, of course, our national chapters, right? We have that local level connection, and we do educational programs, whether it's virtual or in person. So we meet people where they are and where they need us. I'm very
absolutely. And
proud
our
of that
chapters
fact.
are, you should be. Our chapters are a wonderful resource. And I know we have just recently had some great partnerships with some of our research and treatment centers, like the University of Pennsylvania, or the Hospital for Special Surgery, and others, where we're able to
Yep.
partner again with those experts and our chapter leadership to put on wonderful educational programs for people who are living with and who are in the area and want to have that in-person interaction. And it helps them connect with other people in the community too. I know one of the things I'm excited about for next year is our stepping out walks. It was the thing I think I knew the least about when I joined the organization. It's been so fun to be able to get out to some of those this year. And so we're getting that calendar ready for 2024, but such a great way, again, for people to get out and kind of meet people in the
Yeah,
community. And I know you had a chance to get out
I
to a few
did.
as well.
Well, it's So it's one big support group, really. It kind of feels that way because I don't think everybody feels comfortable just talking about their disease, out in the open, but it's with people who truly understand what you're going through. But also in the park that I was in, folks came walking over and they would ask, "So what is this? What's scleroderma?" And it gave us the opportunity to really just raise awareness about the disease and talk to folks about it. It's actually one of my favorite things to do. I wear my scleroderma t-shirt when I go to the supermarket.
Yeah.
So when I'm waiting online, people ask. And it's just a small way that I get to kind of like, raise awareness about the disease right in my own community.
Absolutely. We used to call that back in the day like the taxi cab conversations to say like, do you know what scleroderma is? And that's who I spend my time working for and with and kind of less and less are we in taxi cabs, but Ubers
Yeah.
still work or the grocery
Yes.
store or whatever works just to raise that awareness. I
Yeah.
was on a flight earlier this year, as you know, and got sat next to one of my congressmen. And so I was able to share with
That was
him a
great.
little bit more about what scleroderma is and why that's important and got a meeting with his office out of it. So that was terrific. Well, I know we're really grateful to all of our supporters because 87 cents of every dollar that's given actually goes directly into those programs that you described of helping fund research or education or support and even awareness as well. So I'm really grateful for the work that you and your team do and hope that people take advantage of these programs. They're free and available to you, whether on our website or again, call that Hope Line. And we are just so grateful for everyone that helps us put on these wonderful, wonderful mission delivery programs. And Kate, really grateful to
Yeah.
you and to your team. And again, if you haven't had a chance to give yet to Giving Tuesday, you can go to scleroderma.org/Giving Tuesday. Kate did mention our Hope Line, and so I want to make sure people know about that really great resource. It is in our bio on Facebook, and it's also 800-722-HOPE. Kate, any final thoughts from you in terms of the most exciting part of the work that you and your team are doing every day?
Well, I'm looking forward to, so Monday is going to be, well, the peer review process for this year's grants is currently underway, but the meeting where the reviewers will discuss everything and make recommendations is going to be this coming Monday, and I'm really excited to be there. You know that we're going to be funding the best science. So,
Absolutely. It's
yeah,
really an exciting time in scleroderma for sure. A lot of progress is being made, and it's for everyone in our community and everyone who's joined us today. So thank you all for being here. Thank you for giving on Giving Tuesday. And Kate, thanks for joining.
of course.
All
Thank
right. Thanks,
you.
y'all. Have a good day.
Bye, everyone.
Bye.